Welcome back to another in the continuing series of Medicare topics by the Woodmiller. This one's going to be fairly quick and it's also very important, so you can go back and forth if you need to, but this one's on reviewing your Medicare prescription options and doing it from home. Now, we start this by saying, do you need a review this year? The answer is yes. And if you take any prescriptions or have a prescription plan, whether it's a Part D standalone or inside of an Advantage plan, stay tuned. So I'm going to give you a little bit of a background. Then we're going to go to a tool, Medicare.gov, and show you how this works. So I'm going to speak quickly. I'm going to get this done in under 10 minutes. As I always mention, first of all, everything we talk about here is publicly available information. These are for illustrative purposes, and I do not solicit business. I only educate. I do happen to be a licensed Medicare agent and also a woodworker. So we're talking about specifically today if you have a standalone Part D or if you have an Advantage plan with prescriptions. Now, this is not a political discussion, but you've probably heard of something called the Inflation Reduction Act. That significant changes were made to Medicare specifically around prescription plans. So that's changes to premiums and copays. Let me give you an example. So here is a drug compare that came from Medicare.gov, which I'm going to show you in a minute. But here's a number of medications. They're actually not my medications, but you can see there's a pretty decent swing, $253 and some change between these two plans, and they've changed year over year. And the two that I'm looking at specifically is this Eliquis and then a prescription that I actually can't pronounce. So stay tuned and let me show you how we fine tune this and then how we look at what are our options for the following year based on the medications that we take. So let me give you a little primer on why this is important. So every Medicare prescription plan must have at least the same equal as minimum Medicare required guidelines. However, how they do that is they put it into something called a formulary. So the formulary has a tier system and they get a lot of input from a lot of different experts. And typically they'll put each medication, and it may change from year to year. And this year they're going to change quite a bit. Tier 1 being the lowest tier that's preferred generic, oftentimes it has a $0 copay. And then all the way up to tier 5, which are specialty drugs. And how much do they charge you as a copay for each of those? So things like Lipitor, blood pressure medication, those types of things. Do this. So what I'm going to do is I'm going to go out and I'm going to go into Medicare.gov. So hang with me for 1 second. Okay, so if you type in www.medicare.gov into your browser, you come to this very nice interface from Centers for Medicare. In this case, we're going to use the tool that says Find Healthcare and Drug Plans. Find Plans Now. Now, to make this quicker, I already put in some information, so just follow along. The first thing you do is you pick your coverage year. In this case, I'm going to pick 2025. You type in your zip code. So here I've already done it, but let's say 44321. And it's smart enough to know what county are you in. This zip code has two counties, stretches across two counties. And you may have a different plan depending on the county. In this case, we're going to say Summit. And then we're going to evaluate a Part D standalone plan. Now, if you don't know what Part C and D are, there are other videos that I have links to in this channel that goes through Medicare 101. But in this case, we're going to assume you have a standalone drug plan. You also could do the same thing for an Advantage plan that has prescriptions included. In this case, we're going to say we don't get any extra help. And then we're going to put in our various drugs. You see, I've already preloaded several for this example, but I want to show you how this works. So we add a drug, and what's nice about this tool is it's intuitive. So as you start typing, it tries to figure out what medication you're looking for. Now, I typically say you got to get your prescription bottles together because these all have unique spellings and you need to know your dosages and whether it's a capsule or a tablet. But in this case, you see I typed LIP and it starts to figure out medications with LIP. In this case, I picked Lipitor, and I did this for a reason. because it's also smart enough to know that Lipitor is a name brand and there is a generic, Advorsatin. Now, this would be a discussion where you'd have it with your doctor. If your doctor says the generic is fine, typically we would know from the tier system that the generic should have a lower overall case cost. So in this case, we're going to say the generic is okay with us. Now, you'll notice it allows you to pick your dosages and then quantity. Now, you'll see I have all of these at quantity of 90 every 3 months. Now, you don't have to do this. I do it for a specific reason, and it'll make sense in a minute. So, most Medicare drug plans allow you to order through mail order. Mail order is typically 90 days, and oftentimes that will deliver a lower drug cost doing 90 days. So that's a little pro tip for you. So I'm going to add that drug. And in this case, so that we can get through this presentation quickly, I'm going to say I'm done adding drugs. The next step is pick your pharmacy. You can type in your zip code as you see, 44321. It gives you various options in terms of pharmacies. In this case, I've already selected it. I selected a CVS, which is nearby, and mail order, and I say I'm done. Now, what's nice is when we get to the actual compares, we can sort by various things. We can say, what's our lowest drug deductible? What's our lowest monthly premium? In this case, I want to say, what's the lowest drug and premium? So what's my lowest, sorted by the lowest overall total cost for the year. So I'm going to go ahead and pick two plans, which here I did these two plans, and I'm going to compare them. You can do up to three. And what I wanted to show you here is it will show you a couple things. First of all, if you look here, it's showing you that both plans have CVS as a in-network or preferred pharmacy. And then here's what I was talking about, this mail order thing. You see this one particular program, if you utilize mail order, delivers a significantly lower total cost doing 90-day supplies. Not that you have to do that, it's just an option. Now, if you want more details, you click on Plan Detail, and I like this tool an awful lot because not only does it show you your monthly premium in that plan and then how much you can expect to pay for each medication, as you come down, it lists each drug that you selected to make sure you have the right ones. You see I selected 90-day supplies, and here's where the tier thing would be. 1 is a brand, 3 are generic, whether it's a preferred pharmacy or not. But here's what I really like. Here it's telling me each medication and how much I would pay in network and how much I would pay mail order. And then what I really like here is your estimated monthly drug cost. Now you'll notice since I said 90-day supplies, it breaks it out to January, April, July, and October. And then you'll see by the time I hit October, if I do mail order, it's dropped to a cost of 0. And we have another presentation on why that is and how the total caps are on drug costs. This was simply a presentation on how you use Medicare.gov to evaluate your plan. And we'll kind of wrap up here by saying, why do we want to do this? Well, first of all, every year between October and you have the ability to change a prescription drug plan or an Advantage plan with prescription drugs. So the next step would be to take that information. I always recommend that you contact a licensed independent agent in your area for more information and more input, and they can help you stay with your current plan or make a change. Thank you so much for your time today listening to The Woodmiller. I hope this has helped a lot.